Hello everyone, I'm Priyanka Guhil, and first of all, thank you so much for your response and your appreciation for my previous videos. I hope you like today's video too, and please subscribe the channel, like and share the content, and place your comment. So let's move ahead. So today we are going to learn about the pelvis bone, which is the most common topic in the midwifery subject. So today we will learn about the common anatomical structure of the pelvic bone. That means we will see the different parts of the pelvic bone. Then we will see the basic difference between the male pelvis and the female pelvis. And we will learn about the variation in shape of the female pelvis itself. So here first is the anatomical structure of the pelvis. You might have studied this topic in your anatomy and physiology in the first year BSc nursing. Now here, this pelvis is made up of mainly 4 bones. In that there are 2 innominate bone, 1 sacrum bone and 1 coccyx is there. Now in 2 innominate bone, it is consisting of ilium, ischium and the pubis bone. So here is the structure of pelvis. So there are 2 halves of the pelvic bone. Okay. Now here there is a sacrum. This one is the ilium bone. Here there is a ischium and this is the pubis bone. Now in the sacrum, here this thing is called as sacral promontory. Then here below the sacrum there is coccyx. Now this sacrum is made up of 4 fused vertebrae, whereas the coccyx is made up of 3 fused vertebrae. Now this ilium is a wide bone. And here the border of ilium, this is called as iliac crest, and the corner of the iliac crest, there is a anterior superior iliac spine. Then here there is a iliac fossa. Now this is called as the ischium bone. In ischium bone, this is called as acetabulum cavity. This one is the obturator foramina. And here there is a ischial tuberosity. Now on the back side down, these 2 are the ischial spines. Now this is the pubic bone and in between there is a symphysis pubis, which is also a joint. Now we will see the basic difference in female pelvis and the male pelvis. So on the left side, this image named as A, it is a female pelvis. And the B on the right side, this is a male pelvis. So first I will explain about the male pelvis and then I will explain the female pelvis. These symbols, it represents a female and this is for a male. Now in the male pelvis, if we talk about the adult male pelvis, it is more narrower inside and it is less flat. This area is called as the inlet. So basically the pelvis is divided in 3 things. So upper side is a inlet, in between there is a cavity and down portion, it is called as the outlet. So if we talk about the inlet of male pelvis, it is more narrower and less flat, and that's why it is exhibiting an oval or heart shape. This shape is oval, or you can say it is a heart shape. And the angle of the pubic arch means this area. This is called as pubic arch. In male pelvis, this angle of pubic arch is less than 90 degree. Now, if we talk about the female pelvis, so in the adult female pelvis, it is usually broader comparing to the male pelvis. If you see this area, it is more broader in the female pelvis, and that's why the shape is round pelvic inlet. And the angle of this pubic arch, it is more than 90 degree. See here, it is lesser than 90 degree, whereas in female it is more than 90 degree, and that's why it is supporting the easy birth or easy vaginal delivery. Now we will talk about the variation in female pelvis. So according to the shape of the pelvis, there are 4 types. So first is the gynecoid pelvis, second is anthropoid pelvis, third is anthropoid pelvis, and fourth is platyploid pelvis. Now first we will see the gynecoid pelvis. So this gynecoid pelvis is more delicate and more wider and not as high as the male pelvis. And the angle of the female pubic arch is wide and the round. See here, it is more wider and round. And inside the inlet is also a shape of round. And there are 50% of the occurrence is there. So most of the female is having the gynecoid pelvis. And because of the round shape of the pelvic inlet in gynecoid pelvis, it is facilitating more easy vaginal birth. Now the second one is the anthropoid pelvis. So in the anthropoid pelvis, the inlet is narrow. This inlet area, it is narrow and deep. So that's why the shape is similar to upright egg, or you can say it is a long oval shape. And the occurrence is 25%. Now the third one is anthropoid pelvis. So this anthropoid pelvis is female pelvis with masculine features, and it is including a wedge or heart-shaped inlet, and it is caused by the prominent sacrum. If you see the sacrum on the backside, it is prominent. That's why it is a triangular anterior segment there is, and it is providing a heart shape or a triangular shape. And because of this reduced pelvis outlet, it is often causing problems during the childbirth. And there are 20% of occurrence is there for the anthropoid pelvis in female. Now the fourth one is platyploid. So it is also called flat pelvis because of its shape, and it is most least common type, which is having occurrence of only 5% in the female, and it's wide but shallow, and it resembles an egg or a oval line. That means a transverse oval shape. And if you see on a first, you can see it is a flat shape. So that's it for today. So we have discussed the anatomical structure of pelvis bone. Then we have seen the basic difference between male and female pelvis. And we have seen the variation in female pelvis, that is gynecoid, anthropoid, anthropoid, and platyploid. So gynecoid is round in shape, 50% of occurrence. Anthropoid is narrow and deep, and it is having the long oval shape, 25% of occurrence. Then anthropoid is having the heart shape, 20% of occurrence, and platyploid is flat and having only 5% of the occurrence. So thank you so much everyone for listening. I hope you have understood the topic and I have done it correctly. And see you soon for the next video.